So, good morning, everyone. Uh, to whom that don't know me, my name is Tala V. I'm a training specialist in international noon training specialist. And today's webinar is about skin aging and noon aesthetics anti-aging solutions. When we talk about aging, we have to cover a few points just to clarify the subject. So the points we're going to touch today in this webinar is firstly the definition. What is aging? Epidermis aging and dermis aging, photoaging, free radicals, antioxidant, therapeutic intervention, physiotherapy, skin moisture levels, and turgor. By modern definition, aging is determined as a result of accumulation of defects. And from the day we are born, we are actually going through a process of aging. The defects that we're talking about is in the cells and intercellular fluid, and that destructs vital body system slowly with age. There is a distinction between two kinds of aging. First, genetic aging, which is genetic aging, it's your hereditary tendencies. And secondly, skin aging as a result of external factors such as pollution, UV exposure, smoking in pollution, progress stress, internal and out from the outside, dietary factors, very important, and incorrect treatments, cosmetic and medical. But the most crucial factor, the one that is very much linked with aging process, is the very thing that actually promotes life, and that is sun exposure. And we're going to cover it within a few minutes. First, let's talk about the signs of aging as we can see it in the epidermis part and the dermis part. In this illustration here, you see on the left hand side, young, healthy skin, a representation and illustration. The part which is up here, this is the epidermis structure. And here, the blue, the light blue colored is basalic layer keratinocytes. This yellow bit here is a melanocyte. Here are live cells upwards until you got the stratum corneum at the top. And so you can see in a healthy young skin, everything is stacked and packed in orderly fashion. The melanocytes are sitting in the basalic layer. In about every 10 keratinocytes, you have one melanocyte. It's in an orderly fashion. It is in every skin type when the skin is not having hyperpigmentation disturbances. That would be the amount of melanocytes in a young, healthy skin. And you can see that the structure is very nicely built. When we talk about aging epidermis, it's a little different picture. Instead of having a healthy packed skin where you have a good rate of mitosis in the basalic layer pushing healthy skin cells upwards, we have slow mitosis rate in the basalic layer. Instead of having thick, nice looking epidermis structure, we have thinning of the epidermis. Instead of having a low amount of tight packed stratum corneum, we have a bigger amount of the stratum corneum due to hyperkeratosis, for instance, and then a thinner part of live cells. There is also a reduction in the numbers of melanocytes in 8% to 20% every decade. So instead of having them orderly placed like this, some of them just lose their functions. There is also reduction of Langerhans cells. This is a representation of Langerhans cells. It is connected to the immune system, but this one here is nicely placed, and you can see here, that's what's left of some of it. There is a reduction of the numbers of Langerhans cells, and due to that, there is less immunity to the skin. It's more penetrative to outer environment. Also, accumulation of waste materials. It's harder and sluggish. The way of uh, toxins releasing and evacuated by lymph is not as good function, and it's more sluggish, and there is accumulation of waste materials. And reduction in blood supply to the epidermis due to the fact that it's actually a dermal part here, but it is relating to lack of moisture to the epidermis. The blood vessels are not functioning so well deep in the dermis, and they are the one that are in charge of giving water upwards to the epidermis. That's where we get our water, our hydration, and that is not as goodly supplied. And then we have dry skin, and that is a result of many different factors, but one of the main factors is lack of enough, the reduction in blood supply, not giving enough moisture to the epidermis. When we talk about the dermis aging, let's look again at the young looking skin. So you can see how nicely things are packed over here. Those green little bits are fibroblasts, and the thick strings here are collagen fibers. The thin, nicely waved strings here are elastin fibers. And you can see everything here. The whole structure is very nicely organized and tight. This is what actually gives the support to the skin. It gives us the turgor and the nice looking plumped skin area. It supports the epidermis as well. And if we look at this picture right here, we see it looks completely different. Look at this area here. There is a thinning of the dermis, reduction in the number of cells in the dermis. The fibroblasts and macrophages, look how little, how small amount there is. There is also a reduction in quantity and quality of the collagen fibers and the elastin fibers and the glycosaminoglycans. The whole ECM, extracellular matrix, completely different in this area than in a young skin. It is lacking. It is not in a good quality. It needs support. There is also a relative increase in the number of tissue decomposing enzymes relative to the tissue building enzymes. The whole process of buildup and decay, buildup and decomposing, is very well balanced when in a young skin. And always there is a compensation when there is a decomposing enzymes working on decomposing old collagen, for instance. Then there are other enzymes encouraging new buildup, encouraging the fibroblasts to start build new collagen fibers. The equilibrium between the decomposing enzymes and the tissue building enzymes is destroyed. It's not well balanced, and there are more of the decomposing enzymes relative to the tissue building enzymes. And there is an appearance of distracted elastin fibers. And elastin fibers, that's what gives us the flexibility of the skin. We have a good buildup until the age of 10 or 11, and then it stops except of maybe 1 to 2% buildup. And we have these elastin fibers that were produced till this age of 10 or 11. We have it with us during most of our lives until at least 74 years old or so. And so if we have destruction of these fibers, we have no way to compensate on it naturally. It will not recover naturally. And when you have a clutter of these destructed elastin fibers, you have a phenomena called solar elastosis. And this looks like a spider web, like these fine little lines that are crossing, crisscross like this. And it looks very miserable and shriveled. And this is called solar elastosis. We cannot recover it naturally. The body cannot recover it naturally. So we are, when we talk about anti-aging, we're talking about slowing down the aging process. We're not really talking about stopping aging because that is impossible. It is common to say anti-aging, but it is really slowing down aging process. And so we are bombarded by external factors all day long. It's from all over the place. It's the UV light, it's radiation also from all kinds of gadgets like our phones and our computers. It is smoking, it is pollution in the air. Everything cause a lot of stress to the body and to the skin. And the skin is the frontier, is the part that is facing first all of this uh, uh, all of these external elements. And the skin and the way that it's built, it is meant to protect the body from external invasion. And so it's bombarded. And then this causes a lot of stress and can cause inflammation in the skin, also activating white blood cells, and it's can cause changing in metabolism, and eventually, in some cases, unfortunately, it can cause DNA damage, and then we can face unpleasant diseases. But the skin, first and foremost, is one of the most important protector to the whole body. It's not just the skin itself. We are dealing with beauty, but we must understand the skin is first frontier to all this bombardment. Some things it can be fixed, some things we need to help the skin to fix. And now we're going to dive in and talk about the most crucial factor, the UV light, which is responsible over 90% of problems, skin problems, and of aging. The skin rays, the UV radiation that we are facing, we mainly talk about UVA and UVB rays. The wavelength of UVA is 320 to 380 nanometers, and the UVB rays are 280 to 320 nanometers. The UVC is actually filtered by the ozone, so we don't need to worry about it as long as our ozone is intact. When we talk about UVA and UVB, let's look about this illustration here on the left. You can see the depth or the penetration ability of the UVB ray and the UVA ray. Just to clarify this illustration, this part here until the wavy line here is the epidermis. This wavy line is the basalic layer, and underneath here we have the dermis. And so you can see UVB is penetrating only at the epidermis and maybe a little bit touching the dermis. It's actually reflecting back the light in 70% and then by the stratum corneum, but 20% is penetrating the epidermis and 20% is penetrating the dermis. This rate is actually in charge over our ability to have suntan or to be sunburned. And most interestingly, it's not able to penetrate windows. So, for instance, if you drive your car in a hot day in the summer, you may not get a good suntan, or you will not, you even may not burn because this ray cannot penetrate the window. But we have the UVA, and so when you look at the UVA, look how deeply it penetrates. It penetrates all the way to the dermis. So it actually going through the epidermis and it's harming both areas. This one is this is the quiet, the quiet damage. Why? Because this one, it's not the ray that gives you the suntan. It is actually the daylight that you see. So if you go outside, it can be a sunny day, it can be you know a rainy day, it can be a snowing day. In each day that you go out and you see the light outdoors, that's actually UVA. So it means we're exposed to UVA all year long. And it really doesn't matter if we're in the summertime or the wintertime, We need to take care and protect our skin all year long. This is one of the things that I always suggest to explain and teach the clients, our clients, because sometimes there is a wrong idea that we need to sun protect only when we are exposed to harsh, hot weather. And that is not the case. We need to protect the skin all year long. And in some extreme cases, even like if you want to go skiing in the snow, that is actually uh, um, double exposure, because the snow is reflecting the sunlight even stronger, and you need to even more take care and protect your skin. And of course, during this exposure to the sunlight, on one hand, this is promotion of life. We need to be exposed to sunlight just a little bit every day, because this is one of the things that is healthy to our skin, also helping to produce vitamin D. But at the same time, we're exposed. If it's not measured and it's overexposure, we can get damages. And that is also combined with the damages of free radicals. Free radicals can be formed under stress in the environment, under exposure to sun rays. Sun rays can actually cause free radicals to appear, and also the surrounding, like pollution, like cigarettes and other sources of pollution. So now we're going to talk about free radicals. What does it mean, and how do we approach the subject? Free radicals are a part of an atom or a molecule with a lone pair of electrons with a high reactivity and can cause chain reaction. Let's see, like if we look at this healthy cell, and for some cause, something happened, like maybe strong exposure to the sunlight, and one of the electrons in one of the molecules in the cell was wiped away by the sun. As soon as a pair of electrons are separated, are splitted, and there is no paired electron anymore, then the molecule within this healthy cell can be very, very reactive, trying to compensate. I will explain by another illustration in 1 minute. I just wanted to mention that main free radicals in the body is reactive oxygen. And also, usually in a healthy young body, we have a balanced system of antioxidant enzymes that helps to always protect our body from being bombarded from free radicals. But in unbalanced state, free radicals attack protein, DNA, fats, whatever it meets on the way, and can cause a lot of damage. Let's have a look at a scheme to understand how it actually works. Let's say we're taking a molecule of collagen fiber, and the skin was exposed to strong UVA light, UVB, UVA, and one of this molecule's electrons has been wiped away. This molecule becoming very, very reactive, very unstable, trying to look to compensate on it, to look for a free electron, or maybe an electron from the neighbor, to balance itself back. So it snitches an electron from the neighbor and it soothes itself down, coming back to be a normal collagen molecule. But then the neighbor is being very reactive now, looking for another electron to compensate on the lost. This is happening all the time. This is a natural process in nature. This chain of reactivity with free radicals. Uh, when we have, again, when we have a healthy young skin and body, there is a natural balancing enzyme antioxidant system within our body that knows how to deal with such a problem. But with aging, it's not as effective, and then we may have a problem that even worse than that. Let's say that a free radical of collagen meets another free radical of collagen. Both of them are lacking an electron, and both of them need one to compensate on this loss. If they meet and they join, they're sharing one electron together. This bond is very strong, and this bond is called a dimer. This collagen now is called a dimer of collagen, This is considered to be a defective collagen. It is not recognized by enzymes in the body, in the skin as collagen anymore, and it does not work as collagen. It's actually defected, and the result of accumulation of defects like this can turn to be like we saw before when we have it with elastine fibers. We can have solar elastosis. We actually can have serious damage in this way because the more we have collagens that are not considered to be healthy active collagen, there is no new signals to fibroblasts to produce new healthy collagens, because the cycle of production of healthy collagen is decay of one and then signaling to the fibroblasts to produce another. And when we have these that are not working, not functioning at collagen anymore, but there is no signal to the fibroblasts to produce new, then we have less and less production of new collagen, and we have more and more culture of this defected collagen fibers. What happens if a collagen that turned to be a free radical by itself by losing this electron? What happens if it meets an antioxidant? The antioxidant can easily give an electron, and it would not turn to be a strong reactive free radical. It can turn to be an antioxidant free radical, which is very weak and would not attack the surrounding. And by giving the electron to this collagen free radical, it soothes it and brings it back to normal function. So this is just an illustration on how these things work. And then another example. This is an example of an atom of an antioxidant. And this one here is a free radical because one of the paired electrons was snitched away, let's say by sun radiation. You see here it's paired, here it's paired, another pair, and here it was snitched away. If this antioxidant that has many electrons, as you see, donates one, it wouldn't be so reactive because it has more. So it will turn to be a free radical, but it would be very mild active. It will not try to snitch any electrons from the surrounding, and will stop this vicious cycle of destruction of free radicals. And this is why it's used extensively in cosmeceuticals. We use antioxidant extensively. When we look at antioxidant and talk about antioxidants, the main ones that are considered to be very effective in the industry, of course, are vitamin C. In this case, I'm talking about stable versions of vitamin C, derivatives of vitamin C, less the L-ascorbic acid clean as itself because it is not stable and also very irritating. It's the first generation of vitamin C. There are more advanced vitamin C derivatives, and I will show it to you in a minute. I'm just pointing out that vitamin C is one of the main one of the main source for antioxidants that are considered to be effective and good in good percentage and in good kind high grade derivative. Vitamin E also. Liantopodic acid, which is produced from the eldervise flowers and plant, considered to be very strong antioxidant. Resveratrol is also another one. And C60, which is called also fullerene, which is a very, very interesting antioxidant, and it's 125 times stronger than vitamin C. I can tell you that this interesting antioxidant is in the works now in our labs. So in the future, you may meet it in our products, and it's a good contribution. But we already have a very potent antioxidant, a very strong version of new generation of vitamin C. Let's have a look at that. So like I explained, the first generation of vitamin C is called L-ascorbic acid. This is the actual molecule of vitamin C, of ascorbic acid. But just by itself, it is not stable and it's very irritating. And when we want to use it for cosmeceuticals, it's very hard to get benefits out of it because it can stop being effective as soon as you formulate it. It's very easily becoming unstable. So we use the second and the third generations of vitamin C. Ascorbyl glucoside, which is this is the illustration of the structure of ascorbyl glucoside. You can see that the actual pentagon shape of the ascorbic acid is here, and it's got this tail. It's got this tail. And this is very helpful in structure to help penetrate the epidermis part. Once this molecule of ascorbyl glucoside penetrates the epidermis part due to this tail, it helps it to penetrate. It also helps it to be balanced and not oxidate quickly. Once it's penetrating the epidermis, comes an enzyme that cuts it away and leave and the leftover is evacuated by the lymph, and we are left with the actual active ascorbic acid exactly where we want it to start being active. This way we are using it and the whole potential without waste. We also have another derivative called tetraisopalmitate, which is this is the structure of the molecule, and tetra is for the number four. It's four tails. You see those purple tails? It's four lipid tails connected to the L-ascorbic acid molecule. This structure is very helpful for the uh, L-ascorbic acid molecule. It's very helpful for penetration into the dermis part. We can actually have an illustration for that here. It actually can penetrate the dermis because of the structure of the lipids that are connected to the molecule. As soon as it reaches the dermis, comes an enzyme called esterase and cuts those tails away and evacuates it through the lymph. And then we are left with the L-ascorbic acid in the depth of the dermis, exactly where we want it to be active. So we have multiple derivatives in order to cover the epidermis and the dermis area. And I will show you one of our good, beautiful products containing both of them. Another important point I want to clear up about the ascorbyl glucoside, the first derivative that is relating to the epidermis, it is also well known for lightening effect. And this is due to the fact that it is affecting the process, the chain of producing the melanin. It's affecting in two different areas on the chain of production between the L-DOPA and the dopaquinone, where tyrosinase enzyme is involved. And then again, at the end of the process, to reduce the coloring that already produced as brown. So it's very effective also in contributing for hyperpigmentation cases. And of course, this presentation is on anti-aging, but hyperpigmentation is very much related. It is very much related topic because it comes from the same causes of stress, like the sun exposure and free radicals. And we will talk about hyperpigmentation in a different presentation and webinar. Okay, let's talk about therapeutic intervention. We need to look when we're treating a skin that is aging, we are actually treating a skin that has changes in parameters. And sometimes when a younger client arrives to the clinic, maybe even the age of 30, you're not yet seeing all the damages and problems. You may see it maybe later on. All kinds of dryness of the skin, the structure of the skin looks different, moisture levels are not good. And we will have to address all those points. And I suggest that when we look at the client, especially if we are making observation by the protocol management book, Noon's protocol management book, then if we see that we have a client with dry skin, and even if she or he is younger than and has actually quite nice skin, we still need to be in check and watch all the parameters and give support to those parameters because aging is a process, and it's getting worse with time. So if we're talking about um, slowing down this process, then we want to start as early as possible. So we're going to touch those points: the skin turgor, which has changes, moisture levels are affected, ECM state, which is the extracellular matrix. What's the state of the ECM of the client? Blood vessel state. Do you see like strong looking capillars or broken capillars, or maybe blushing skin or pale skin? What's the blood vessel state? Color of the skin and its uniformity, pigmentation, hyper, hypo, blood vessel state again. So we're looking at all of these. When we talk about skin moisture level, we need to address few points. Epidermal fat deficiency, which is deficiency in ceramides and unsaturated fat acids. This is actually relating to the subject of skin barrier. Skin barrier is the barrier that helps the skin to protect and to help the skin to retain the water that is delivered within the dermis to the epidermis. It is very important uh, to avoid dehydration. And when we have lack of the ingredients, for instance, ceramides is at least around 45% of this barrier. And if we have lack of that, and they start really early, starting from the age of 30 already, you can see drop down in the amounts of ceramides. We can actually see that the skin is getting dehydrated and very dry easily. And what we need to provide nutrients, cosmetic ingredients that contains lipids to support this barrier, this protective barrier. NMF balance disturbances, we see that as well. Factors allowing absorption of humidity from the air. When we have lack of the ingredients or sluggish production of these ingredients, and some of the ingredients of the NMF is lactic acid salts, amino acid, urea. If we have lack of this or sluggish production, then of course it is affecting the moisture levels of the skin. And the way that we address that, we need to provide lactic acid products, and anything to do with acids is lactic acid is very good, because lactic acid is something that's familiar to the skin. It's part of the natural NMF. Amino acids, hydrolyzed protein, sodium PCA, and hyaluronic acid to boost and support the ability to hold moisture. Another phenomena is an abnormal stratum corneum, like hyperkeratosis or parakeratosis. And for hyperkeratosis, we need to provide peels and creams containing peeling ingredients like lactic acid in 10%, 15%, or combined 10% of lactic acid, 2% salicylic. And also, we provide retinoids that is very beneficial for that reason too. We need to get the basalic layer in higher rate mitosis, and when the mitosis is getting better, then the skin is getting rid of the excess too many stratum corneum drying cells, and compensate with healthy live skin cells. And then the stratum corneum becomes thinner, and the live cells area becomes thicker, more of the tendency of a young looking skin, like the one that we saw in the illustration in the beginning of this webinar, if you recall. Lack of ECM ingredients, lack of extracellular matrix ingredients. We provide peptides, neuropeptides that helps to be acting as messengers to help to boost all kind of different process of regeneration in the dermis. Mesotherapy, we use mesotherapy devices. And 50% glycolic acid peels and 20 to 40% pyruvic type of peels which are known to be able in a pH under 1, known to be able to penetrate the dermis area and stimulate buildup of the extracellular matrix. Abnormal blood vessels in the dermis. We said that it is affecting the epidermis, the lack of moisture, because when the blood vessels are damaged or they have weak walls or the blood supply is sluggish, then we don't have enough release of moisture to the tissue around and to the dermis and the epidermis. So we address it with physiotherapy device, like electroporation device, massage to help to stimulate area to flow to a better flow of blood circulation, and retinoids when it's applicable because it's strengthening the capillary wall. When it's applicable, we mean by that there is no additional problems that should be because of that it should be avoided. For instance, in case of seborrheic skin or rosacea, it is difficult to work with retinoids in this matter. So when it's applicable, we use it to encourage the capillary wall to be more flexible, more healthy, and then the hydration and the release of moisture is much easier towards the tissue around. The therapeutic intervention we have within our products, we have uh, for epidermal fat deficiency, for the deficiency of ingredients of the skin barrier. First, we will probably provide the lactoceramide 15 because it contains ceramides there, 2, 3, and 6, and it's very supportive to this barrier. And as I mentioned, ceramides are about 45% of the barrier structure, so it's very useful. On top of that, of course, we have the lactic acid function. We can also work with the um, trio leaf mask as a supplement, like twice a week or the in clinique just to give a little boost, also containing some fatty acids, and filler cream also to support the barrier. And that would be on a daily use, of course. For the NMF balance disturbance, we use lactic acid, amino acids, hyaluronic acid, sodium PCA, and hydrolyzed protein. So again, you can see the filler cream and filler serum containing sodium PCA and also hyaluronic acid. We have the lactic acid products, which are the base of every home care treatment, actually not just for anti-aging, for general health of the skin. That would be always the first product to provide to a client to get a good, stable condition and healthy uh, epidermal turnover of the cells. And we have three versions. We have the Lacto 10, which is suitable for all skin types. We have lactoceramide 15, which also contains the ceramides, like we said before. And we have the intensive hydrogel, which is also suitable for this purpose. So we have one of these choices chosen for a client. Some clients maybe need an anti-aging treatment, but they can still be oily skin, for instance, and then the intensive hydrogel will be perfect in this case. We have the Trio Lift mask and the e-glue mask, which also contain hydration. The Trio Lift mask contains hydrolyzed protein, also can be used like twice a week if you wanted, once a week as a supplement, as support. And the e-glue mask as well. The e-glue mask contains an ingredient called xylithiol, and that is boosting the natural production of hyaluronic acid. So it's also good for hydration. It can also be used once or twice a week. And I know that some clients like every now and then to even sleep with this mask on their face applied on top of the other of their products. and they report that their skin in the morning looks like marble, looks like beautiful. And actually, I've tried it a few times, and I like it too. So every now and then, not every night, but just like, yeah, you can give it a try. It's a nice thing to try. We also have the Igloo cream, of course, and the Igloo cream also contains hydration it's called the 24/7 cream because it holds the hydration for a long time, and also containing good hydration factors. And also our ampules. All of the three kinds of ampules we have for the in clinic as well as the home care. This size is the home care size. It's a packet of three. It can last for maybe between 3 weeks to a month, because you use about just 3, 4 drops in the morning and in the evening. But all of the three, the lift and whitening ampules, which is classically anti-aging, but also hydrocalming and vitcom ampules, and acno complex ampules, all of them containing high quality and percent of sodium PCA, and also other hydrating factors, including hyaluronic acid, and so it can help and boost this deficiency of moisture levels of the enema. Abnormal stratum corneum. For this, of course, we will address firstly with acids, because as we said, it is important to have a healthy turnover of the basalic layer in order to get the stratum corneum state in shape. The more we have a healthy turnover, the thinner and healthier and a more intact uh, stratum corneum we have, not too thin, not too thick, just exactly as it should. And we get rid of the hyperkeratosis. And so in this case, we can use, and we do use, all of our peels in the clinic. Of course, we use the G peel, G peel Nano, P peel 20, P peel 40, J peel Delicate, S peel, and all of them we choose to use by protocol, and in the way that is adjusted to the skin that is in front of us. And we need to choose the right protocol in order to give good results and smooth work with a client. Not too strong, not too weak, just the exact amount of ingredient or of peel at the exact minutes and the exact protocol. It's very important. Another thing that is tremendously helping for a healthy buildup in the skin and healthy stratum corneum is using retinol. And our retinol, Charisma, is pure version of retinol. It's a very highly effective, and it is well balanced in a formulation. It's got support of lantopodic acid, which is a very strong antioxidant. It protects it from oxidating, and it gives a very potent product. When you use this product, you can see very fast the results because you can see that it's working. It's very bringing the skin to life. And here we have three different percentage of use. We have 0.3, the 1%, the 1.6, and we choose the right percentage to the state of the skin. For instance, I would not give 1.6 to a skin that does not use retinol, does have no acquaintance with retinol. It's just the same as I would not give a gym session you would not give a gym session to someone who uh, just like a strong gym session to someone who doesn't do sports at all. You will start with more a gentle way of approach in the gym class. So just the same, we have to go with the skin. We don't want to push it when it's not right. So zero point 0.3 is very useful and it's very effective for everyone. I recommend to start with it, but you can also start with 1% if the client is already using retinoids extensively, like the tretinoin or Kligman solution. You can start with the one. Also 1.6 if there is a Kligman solution that was used, which was in a stronger version, you can use that. It is very effective. We also give it as important factor to support hyperpigmentation cases in different cases. And of course, the first and most important one that we keep on repeating, I keep on repeating to you, lactic acid for home care is the first thing to have at home. Even if I will give retinol charisma and do peels, I would not do it without supplying also the lactic acid. It has to work together as a team. So lacto 10, lactoceramide 15, intensive hydrogel, that is important. And as for the mutual synergic effect with the retinol, it's evident to have a mutual synergic effect. The retinol helps the mitosis, the cell mitosis in the basalic layer, and the lactic acid is known to be able to get to help the cells push upwards, very tacked and nicely built, very nice structure, and also support hyperpigmentation treatments. So it works in synergy and always should be supplied together. If you choose to give retinol, that would be always be provided with lactic acid for home care. Lack of ECM ingredients. We use 50% glycolic acid peels, 20 to 40% pyruvic peels, peptides, mesotherapy device, and retinoids. So, in order to work with the ECM, the extracellular matrix, this area is in the dermis, and the peels that affect the dermis area are the G peel, G peel nano, P peel 20, P peel 40. Out of our six peels, the J peel delicate and the S peel are relating to providing treatment to the epidermis, but it does not reach the dermis part. So when we work on ECM, we need to make sure that we use one of these according to protocol and to the case we are dealing with. We can add the S-peel and J-peel in for a good polish for the epidermis, also in the same treatment when we use G-peel or G-peel nano. But it's like an extra polish. It's not working on the ECM, it's more the epidermal effect. But when we work with pyruvic acid peels, we choose either the 20 or the 40. We don't mix it with the J peel delicate or S peel. It's just by itself. You will see it in the protocol management book. For the home care, again, we have trio lift mask for twice a week, once a week if we'd like. We have the filler serum and filler cream also with peptides and neuropeptides to help the uh, build up in the dermis. Also, in the serum, we have an ingredient that is relating to encouraging the fibroblast to increase buildup of hyaluronic acid, which is very unique. And in the filler cream, we have peptides that help to build up the other parts of the extracellular matrix, like collagen fibers of different kinds. So they work together in synergy for the dermis part, encouraging the dermis, the turgor, and also the buildup in the dermis. Lift and whitening ampules based on matrixyl peptides. This, of course, is encouraging the buildup of collagen and the ingredients of the ECM. And retinol again. As you see, retinol is a star because retinol is a gold standard in cosmeceuticals, and referring to anti-aging is one of the important ingredient we can use in order to affect the dermis part. And last and very good, very effective equipment we use is our triple MCH. It's an electroporation device. It can provide a good workup for the dermis. It helps us to ingredients to penetrate to the dermis. About 70% in what we use can penetrate when we use a device like this. And when just that you can compare, of course, there are so many different technologies, but this one is well proved, and it is also being used in laboratories, research laboratories, in hospitals, the frequency of electroporation is used in laboratories, in hospitals, and it is well established that it can give penetration of 70% to the dermis. This is a lot, and it's fast penetration. So we can use an ampule, like a 5 milliliter ampule, a whole ampule in a treatment, and that is very, very effective. Um, when we spread an ampule on our skin, of course, there is also penetration just by using it home when we spread it on our skin. But we have to spread it on our skin daily, morning and evening for a period of time in order for it to give effect. And why is that? Because all of the ingredients that we're using that are considered to be penetrative to the dermis and the epidermis, they have time to penetrate, and some of them are lost in the way naturally. And so, in any case, whatever we use as cosmeceutical, an ingredient that is considered to be penetrative, only zero point 0.3 can penetrate and can actually get to the target. So, this is why when we work with home care products, we repeat the use. We repeat the use daily, morning and evening, or just morning or just evening, but repetitively, and then you can start seeing results. With active ingredients, you never see results on the spot. It's always a process. Abnormal blood vessels in the dermis, mostly like capillars and broken veins and things like this. What we suggest, what we usually use, again, we used our electroporation device. In our device, we have a cooling function and a warming function, cooling to minus 20 degrees and warming to 43 degrees. And this cooling and warming is helping the skin to get the better blood flow, blood circulation. And good blood circulation is providing new oxygens, and it's good and important. So, this is why. Also, gentle massage can help. And when it's applicable, when you don't have another situation in the background, like seborrhea case or rosacea case, then when it's applicable and the skin don't have these phenomena, then we provide also retinoids like retinol charisma, because it is known to be helping the capillary wall to be more flexible and healthy. And then it helps the whole function of this capillary area. To sum this up, I would advise you to consult with a protocol and management professional guide. This is one of the most helpful guides I ever seen, because this one provides over 20 in clinic and home care protocols. It's very elaborated. You can find all kind of different cases and complex situation covered there. And if you want to get good professional top performance results, you want to get the best adjusted protocol. So never give up on this book. Always use the advanced method of diagnosis of skin conditions, getting to the point just to get the right protocol for your client. And it is giving a very effective treatment for dry skin and dehydrated skin conditions. And each of us is a little different. And this is why this book is addressing each case. And this is why I advise you to have the advanced method of diagnosis before you choose the protocol or the theory for your client. The extracellular matrix, collagen, elastin, glycosaminoglycans, they are all in a sluggish production and less in the dermis. This is why we get thinning of the dermis. And what do we use? What are the ingredients that are considered to be effective? Things that are considered to be effective for the dermis. So peptides, regulatory peptides like neuropeptides are very good. Antioxidants, of course, can help a lot. 50% glycolic acid pills and P pill 2040 in the pH under 1 can help a lot, and retinoids. And when we look at the ingredients within our line of products, the collagen buildup stimulation and elastin fiber stimulation. Mind you, the elastin fiber stimulation is minor because elastin, like we talked before, cannot really rebuild extensively. It's what you have when you're young, that's what you have when you're old mostly. Maybe 1 to 2% ability to reproduce, but that's very minor. That's not serious, but that's what we can provide with cosmeceuticals. So collagen buildup is evident, elastin to some extent, glycosaminoglycan buildup stimulants, and the whole extracellular matrix stimulants. First, we will address it with in clinic part would be with peels. Again, the one that address the dermis as well. It's G peel, G peel nano, P peel 20, P peel 40, and no S peel, no J peel delicate would affect this, but it can be added to the treatment for a nice polish for the stratum corneum. We can do that, like in treatment where you have G peel or G peel nano. We will definitely avoid the S peel and J peel delicate when we do peels like P peel 20 and P peel 40. Peptides in the metric seal complex, like leaf and whitening ampules that we have, these peptides are regulatory peptides. They're helping the buildup, and it's good to use it in the clinic and at home. In-depth filler cream, and serum. These are also helping boost the buildup of the extracellular matrix. And Vitsi serum, a strong antioxidant. It contains 11% of stable version of vitamin C. Vitamin C, like ascorbyl glucoside and tetraisopalmitate. And in this percentage, it's also boosting brightening of the skin. It is very effective. It's for all ages and all skin conditions. You can use that. And we add it to the treatment. And of course, we cannot go without the retinol charisma, which is a gold standard, of course. And we provide it by a case, like I suggested before. If the client is not used to retinol, start with zero point 0.3. And if they're already using to retinol, you can start with one. And the ones that are used to tretinoin, like in the Kliegman solution, you can even start with 1.6 if you like. It is very, very effective. And it's also containing another interesting ingredient, not mentioned here, just a little anecdote. It contains an ingredient called prefluocarbon, which is it's actually 30% of these products of the retinol charisma product. It is this emulsion is delivering oxygen to the tissue, so it brings the tissue alive. It helps the tissue for healthy metabolism, and it's boosting the activity of the retinol. And our retinol charisma, the formulation is very unique, and this is one of its strength point, that is based on synergetic effect between ingredients, not just retinol with this prefluocarbon and with more interesting ingredients. And when we talk about retinoids, maybe in another webinar, we can elaborate about that. And once again, I advise you well to use the protocol management book. It's very helpful in this manner, especially in choosing the right treatments in the clinic. If we have dark complexion or bright complexion, sensitive skin or resistant skin, we need to know that before we choose using the in-clinic peels, and also before choosing the home products. And it's important to make sure that we are very much into the right protocol, and then we can get the best results ever that we can with cosmeceuticals. Well, we cannot finish this presentation before we state this important thing. And this is what I said in the beginning, and I repeat myself: sun protection all year long. If we say it's 90% of skin problems and aging process, then we must encourage our clients to protect their skin properly. That means in the morning and then during the day on every exposure, average of every 2 hours of exposure. That is the difference between getting UVA, UVB penetrating and destroying areas in her epidermis and dermis, and between getting them reflected back and have less stressed out skin. And when the skin is less stressed, it can actually maintain its youth longer than its average lifetime. This is why it's so important to state it and it's so important to teach it to your clients. We have two types of sun protection, this multivit sun protector, and it's also sunblock, and the brush and go that is for normal skin, and also we have one that is antiseptic for problematic skin. uh, you can use either one, or in worst cases, I would suggest to use the cream in the morning, and I will explain why in a minute, and then during the day the brush. I call it the double protection, and the reason is that the cream contains also other ingredients that I want on my skin, like vitamins, or like ectoine, which is an ingredient. It's a very unique ingredient. It comes from microorganisms and that lives in harsh conditions and can maintain healthy life. And this ability to strengthen up immunity is boosting the skin's immunity to resist hazards from the outside, making the skin less irritated, less nervous, less reactive to the outside. And this is very, very important to get less stressed of out skin when we go out to our day. This is why I suggest to have a cream and then repeatedly covering, protecting with the sun protection in a brush, in a powder to sun protect all during the day. So, okay, everybody. So until next time, thank you very much for joining me and take care. Goodbye.